Okay, we can then move on to key muscle or myotomal testing. As I say, there is a bit of a problem with this because of the overlap. Now, Beaver's test is you have the abdominal muscles contract fairly lightly and you're looking for deviation in the umbilicus. Now, if all things are equal, then you should have no deviation as they do this. And you visually divide the abdomen up into 4 quarters with the umbilicus being the center point. And again, if the muscles is well balanced and there's no dysfunction, the pull in this quadrant, the right upper quadrant, should equal the pull in the right lower quadrant. Similarly, the pull in the left upper quadrant should equal the pull in this quadrant. So that when all the muscles contract, there's an equal pull centrally and the umbilicus doesn't move. If, though, for example, we have a weakness in one of the muscles in this quadrant, when we contract, there'll be a relatively increased strength on this upper right quadrant, and so the umbilicus will tend to be pulled to the right. Now, if we do too strong a contraction with this, then because we're not doing a maximum contraction, everything will balance out. So we're looking at a fairly gentle contraction, and we're looking for an immediate deviation in this because it may well recover itself. So all we do is, while we're watching the abdomen, is just have the patient just lift their head up, and we look to see what the umbilicus is doing. Now, in Beverly's case, it's moving downwards, which is okay. It's indicating that there's not a unilateral problem, and almost certainly what's happening here, it's moving downwards because there's a muscle imbalance between the upper and the lower abdominals, which is quite normal, or at least common. And in this case, the lower abdominals are stronger than the upper, but we're actually looking for a deviation diagonally, which would indicate that the opposite quadrant is less strong than the one it's moving towards. We can run some tests through the intercostal muscles. So just get you to sit up for me, Beverly. Swing your legs this way for me. And as I say, you obviously can't say, let's contract C8, T8 intercostal. It's just not going to do it for you. So what we'll do is we'll get her to take a breath in, deep breath in, hold it, and I'll just try to slip my fingers into the intercostal space that I'm interested in. And I'll compare the two sides and just push in and just see whether or not one side is giving. And I can slip my fingers in easier on one side than the other. And if I can, it would suggest to me that the muscle is not doing its job. Now, if I'm doing that and she's breathing normally and I can still get my fingers in, it would suggest it's hypotonic. If she's holding a breath in, then it would suggest that it's weak. Okay. In fact, that's about all you can really do as far as muscle testing is concerned for neurological problems.